Have you ever considered how badly sin taxes affect public health? Friends, sin taxes are an important issue that aims to reduce the use and consumption of products that seriously threaten public health, such as tobacco products, alcohol, and processed convenience foods. The World Health Organization defines these taxes as excise duties on products that are harmful to human health and aims to reduce public health risks. Tobacco, processed convenience foods, and beverages are among the biggest targets of these taxes. For example, long-term tobacco use increases the risk of cardiovascular and respiratory diseases, while excessive consumption of convenience foods or fast food leads to health problems such as obesity. Research shows that these taxes significantly affect consumer behavior and health outcomes. This is particularly evident in Latin American countries, where unhealthy diets and lifestyle-related diseases are on the rise. Sin taxes encourage people to choose healthier alternatives by increasing the cost of consumption of products that are harmful to health. This has been particularly effective on artificially sweetened beverages. Research shows that tax increases on such products lead to a significant reduction in consumption. In high-income countries, these taxes are an important source of government revenue. They finance health initiatives and help to reduce the burden on the health system to a significant extent. However, for low- and middle-income countries in Latin America, the impact is more complex. This is mainly due to the fact that policies in this area have not yet been widely and systematically implemented. From an economic point of view, sin taxes are indirect taxes, i.e., they do not apply to people's income, but to the goods sold in stores. Taxes can be organized in two different ways. Tax per unit. A fixed amount is charged per unit or kilo of a particular product. Ad valorem tax. A percentage based on the value of the product. Both of these types of taxes have the potential to both generate revenue and reduce consumption. By taxing unhealthy products extra, governments can raise additional funds for health spending without cutting budgets. This is especially critical for Latin American countries, where health spending is low and obesity is widespread. In these regions, health problems are growing rapidly, and more than 20% of young people are obese. Obesity has become one of the most prevalent and serious health problems in many parts of the world, particularly in the United States. Latin American countries have much lower sin taxes compared to Organization for Economic Cooperation and Development, OECD countries. Therefore, the consumption of tobacco and sugary drinks in particular is still quite high. For example, in Ecuador and Peru, cigarette consumption rates are low, while in other countries, per capita cigarette consumption is more than 500 cigarettes per year. But can sin taxes really be effective for public health? Research suggests that it is possible. While successful results have been achieved in high-income countries, such as the United States, it is unclear whether these results are directly applicable to countries such as Latin America. This is because living standards, cultural and economic factors make the process more complex. For this reason, a study was conducted to examine the impact of sin taxes on consumption income and health across Latin America. This research analyzed 34 different studies that found that taxes reduce demand for harmful products, create new sources of revenue, and reduce disease risks. However, the effects on health vary from country to country. Illicit trade activities such as smuggling and different demographics can greatly alter the size of the impact. Research highlights that most measures have focused on tobacco, alcohol, and sugary drinks, with Mexico and Brazil in particular making significant efforts. Friends, in conclusion, we must recognize that while sin taxes are not a panacea, they are a highly effective tool when applied carefully and systematically, and supported by strong policies. These findings show that with the right approach, countries in Latin America can use sin taxes to tackle public health problems and generate much-needed additional revenues for the health system. Avoid alcohol, tobacco, and unhealthy processed foods for your health. If you liked the video, don't forget to subscribe to the channel, like the videos, and turn on notifications. See you in the next video.